Hi, my name is Brooke Biggett, and I'm going to explain to you how motor behavior will impact my future. Motor behavior is something that I have enjoyed learning about due to the fact that it is the study of how motor skills are learned, controlled, and developed. In the future, I hope to become a physical therapist specifically for athletes, therefore, learning how to teach injured players to get healthy again is something I need to learn how to do. Because I have been surrounded with sports my entire life, there have been many incidents when I had to be treated by a physical therapist after having an injury. My junior year of high school was the moment I decided to become a physical therapist because that was the first time I consistently had to do PT since it was my last year of summer ball and my last chance to be seen by college coaches. I play basketball and have trained my entire life for the opportunity to play Division I basketball, and every summer I would get the opportunity to compete on my travel team and show the skills that I developed over the years. During the summer of my junior year, I had a severe level 3 ankle sprain, and I went to the best physical therapist I knew to heal my ankle as soon as possible so that I could get back on the court and continue my recruiting process. In the couple weeks that I went, it was a combination of intense massages to push the fluid buildup out of my ankle, and then I was put through several stability skills to gain strength back in the tendons that were weak and so far stretched out. A couple of exercises included inversion and eversion ankle pumps, calf stretches, balancing on my hurt ankle, and squats. Once I got those down, I would use bands to add resistance, get higher on the slant board when doing calf stretches, and progressively got lower on the squats. After doing these repeatedly over a few weeks, my ankle was good as new, in fact, even stronger than before, and I was finally able to return to play full speed. Of the three disciplines, I'm most interested in motor learning because it is the actual acquisition of skills and practice. And from experience, after having a major injury, your body almost has to relearn how to make certain movements because your muscle, tendon, or ligament is not as strong as it was before. The mountain of motor development breaks down the typical patterns of skill development throughout one's lifespan into 5 different periods, although I am only going to focus on the top 3 stages since that is more related to sports physical therapy. From ages 1 through 7, the period of the motor development mountain is called fundamental motor patterns, which is the acquisition of locomotor and object control skills such as running, jumping, throwing, and catching. This stage is crucial in developing the fundamental motor skills competence needed as adults in order to avoid physical inactivity due to the lack of exercise at a young age. The next stage of the mountain is where those context-specific motor skills are developed from around age 7 to 11. Because the stage is sports specific, it requires much more coordination, which is why if there is any lack of proficiency in locomotor, manipulative, or stability skills, they may not be able to pass what's known as the proficiency barrier and move on from the fundamental motor pattern stage. Finally, the last stage of the pyramid is skillfulness, which occurs from the age 11 and on. Because I play Division I basketball, I consider myself to be in this category, and that I have worked all my life to develop the skills to perfect my play as much as I can. During this past season, I sprained my MCL, which affected my placement on the pyramid, as I dropped down to the fundamental motor pattern stage to compensate for the injury. Even though I had a traumatic blow to my knee, I was extremely lucky to be walking almost completely normal the next day, with minor swelling, although it was extremely painful to bend my knee and it felt very unstable. This is a video of me spraining my MCL. The girl runs into me on my knee, and because I was standing straight up, it made my knee go inward, spraining the MCL. I'm going to replay it so you have a better view. And I completely lost stability and fell back in a lot of pain. In the beginning of my rehab, we started in the training room because it was a closed and controlled environment. I did a whole bunch of stability skills such as bending, stretching, pushing, pulling, and balancing with a very stretchy band to gain the strength back that I needed in order to heal. Although this was the most painful part of rehab, it was the most important because without doing these movements every day, my ligaments and connecting muscles would stay weak, and they would also attract a bunch of fluid buildup and scar tissue. After about a week of those exercises, I was finally able to move on to locomotor skills such as jumping side to side, step ups, lunges, and jogging, all still in a closed and controlled environment. At this point, I was very eager to get back on the basketball court and finally convinced my therapist to progress to a more familiar environment, such as the court, to do more movements so that I could see how it would feel. The next step was to move on to manipulative skills now that my knee was beginning to gain more strength and I was feeling much more stable than I did the first 2 weeks after I sprained it. We started with balancing on my hurt leg while I threw a basketball back and forth and passing the ball while doing defensive slides as well. And these movements were all done as self-paced skills based on what I could handle at the time. Once those skills became very comfortable and easy for me to do, I moved on to full speed, non-contact workouts that consisted of full court layups, pull-ups, threes, and ball handling. Finally, after what felt like years, I was ready to progress into an open environment with contact, which was hard mentally at first since I was so scared that it would hurt if I hit it the wrong way. But with many reps, I was able to trust that my MCL was strong again and could handle impact without giving out, and I was ready to return to playing games. Through all the physical therapy sessions I had to do, I'm now fully recovered and back at the top of the pyramid. Overall, the mountain of motor development has really helped me to understand motor development all throughout life and how an injury could affect my placement on it. With the help of my PT sessions and learning how we mentally and physically learn how to develop a skill, I hope to help other athletes in the future with injuries return to play just as people help me. And I know that I will be able to relate to them in the frustration it may cause when your body isn't ready, even though you may think it is. I can't wait to show what I have learned in this class to my future patients as I help them physically and mentally grow stronger after an injury.